What does the CDC need to do going forward to make things clear as this pandemic continues to morph?
You know, Chris, the CDC has had a real communication problem for the 22 months of the pandemic. It is difficult to translate complicated, fast-moving, and evolving science to make sure that there is a daily behavior change in people. The CDC needs to recognize that it is not only a scientific and advisory organization, but it is also an organization of patient and public education. And so there is that missing middleman who can really translate that hard science into behavior change. And that is clearly what is missing right now and has for the duration of the pandemic.
Of the 15 tests that you've currently approved for over-the-counter, how many detect Omicron?
We're still working on that, but we believe all of them detect Omicron. We simply feel they are somewhat less sensitive than they were to some of the previous variants.
Of the 50 million tests that the ASPR has contracted for, how many of those tests detect Omicron?
I don't know which tests there are. We can get back to you on that.
So you haven't consulted with what we're purchasing on the 500 million. They haven't consulted with FDA to figure out whether the tests they're buying actually detect Omicron.
I believe they have. I simply don't have that list.
Again, for people looking out there who are watching this and are confused, no more, sure about what they should do than they were before they started watching this hearing. From your perspective, what's the best strategy for people who want to test at home and who now know they can start getting those tests paid for if they have private insurance?
So, Chris, that was a truly cringeworthy moment of undermining that sense of confidence and credibility. Our current home tests work to detect Omicron. No test, it's difficult. No test is 100%. But often we see that in early stages on day 2, 3, we have excellent detection of Omicron. So our current tests, the 15 on the market, work to detect Omicron. And that is such an important point to really drive home for all of those people who are very concerned about the spread right now, like the 330 million Americans who are really faced with this Omicron surge.
I want to dig deeper, too, into these rising hospitalizations. The Washington Post notes what we could be in for. Quote, if models of Omicron spread prove accurate, even the researchers who produce them admit forecasts are difficult during a pandemic. Current numbers may seem small in just a few weeks. Disease modelers are predicting total hospitalizations in the 275,000 to 300,000 range when the peak is reached, probably later this month. That's double what we have right now. And of course, you always have to add into that the fact that some of the people who are testing positive, far too many of them, are the healthcare workers who are needed to deal with this surge. Explain what this could mean for our healthcare system. I mean, if we bend it to these levels, could it break?
Currently, we are at a critical point in our healthcare system. So many places around the country are functioning in a crisis standard of care. Currently, based on all of the modeling and extrapolation, we believe that we are picking up about 30% of infections. So it is very likely that these numbers are smaller than we are reporting. We are seeing a rise, and we will not see peak numbers of hospitalizations yet. That will happen in the next several weeks because, first, hospitalizations are a lagging indicator of the entire caseload, and we are currently seeing cases of about 700,000 a day here in the U.S.
Dr. Aditi Nerurkar, Leanne Caldwell, thanks to both of you. And we're going to continue to keep our eye on that testimony at the COVID hearing this morning.